Well, greetings again from Dr. Bill Wyatt here in beautiful Glen Rose, Texas. And I want to talk to you a little bit about expansion of adults' arches. We thought that adults were set and you couldn't spread their arches out. This particular lady, we've got a complete video on where we went out with the sides and it brought the anterior teeth back and it took away some protrusion. But when you look at it where people didn't think you could expand the arch of somebody and get it to stay out there, and we did this, and I've got pictures of her 9 years later where it's still out there. And this lady worked for me, and I know her personally, and she is still there. And it's been years since it's 1987, I believe, since we started this. So I'm going to run through this pretty quick, but just let me get my little deal going here. Now, I'm just going to show you her arches. This is the lower arch. When she came in, the lower arch was lined up like this, and the cuspids were in this area right here, and these teeth are crowded as all get out, and we went in with nothing but these large arch wires and expanded this. Now we had the big wire, it's an 040 40 thousandths wire, or a 36 thousandths, like a 036, a round stainless steel wire. And we would build one that was out something like this, and we would tie it to these teeth, and you can actually run it out where you want to make it fit. If you don't want to expand right in here, you have this come in close, and you pull it up here, and then you pull this more, and you can put the expansion out here, or you can expand right here in front by the way you bring this across in this way. So you can take those large arch wires and use them on both upper arches. Now, of course, you don't have any sutures that you're trying to separate on the bottom arch. It'd be the upper arch for that. So let's go and look at the upper arch now and see what it's like. Now this was 1987 right here, and then 9 years later, there's 1996 instead of 87. So there's about 9 years that the difference in this, and this was out like this for 9 years, and I've known this lady. She worked for me for a while, and then she moved to Granbury, and I've kept up with her after that, and she is still out there. And so people can go out there. Now you have to, when you do this much expansion in here, you have to put some buccal root torque. In other words, you have a second arch wire in here, and the torque on it, I'm looking at it like I just cut a piece of wire. It'd be something not that much, but you'd have to bend this over to get it in there, and it would have an effect of bringing the root structure out, you see. This would be on the bottom part, and it would tend to bring the root structure out as you push the molar teeth out. Then the root structure follows it. If you don't, it'll lean out, and then these brackets, these cusps over here will touch before the other cuspids do. So let's skip this, and we'll go on now to the upper arch. And here is the upper arch. We're not trying to fool you by making one bigger than the other. This one looks a little bigger than this one, but the width of this arch right here is much bigger over on this side of the mouth now. And we've expanded it, but the suture stayed in place. And that's something that I really want to put out. We have expanded many, many adults' arches. In other words, bring it out and line it up. I've got one man, I think he was nearly 80 years old when he started, and we expanded his arch. So this old idea of, we had one person call me and said he's 24 something, 25, and he went into his whoever was working on his teeth, and they said, well, your bone is set and you can't expand it. And how wrong that is. In other words, you can expand somebody's arch even if at whatever age they are. I know I could have mine expanded if I wanted to go through that at this age. Now, let's go and look at some other things on here. This lady had a temporomandibular joint problem also, so we advanced her mandible. We brought the mandible forward, and somebody's asking for more lower advancement. This brings the lower jaw forward more, and then we put something here to bite on. Now, if you just kind of slide your teeth out here and you bite on your front teeth and you don't have anything to support it, the weight in this part of your mouth, then all the weight is on the back part. No, excuse me, not on here. It's on the condyle back in here, where the condyle is on the deal. You slide your jaw forward, the weight is on the condyle, and it's over in the anterior part by something. If you just bite these teeth together out here, you may move your jaw forward, but this is where the load is, and this is where it is. And you can't heal the jaw up, the retrodiscal tissue. You have to build something in between, and this is what a splint does, so that your bite is taking the force here, and this, when you bring it forward, is not taking the force. And that's where your pain is, in your retrodiscal tissue back here. So here is the lower Big Daddy arch wire. That's an O4O arch wire. And the same thing up here is an O4O arch wire. And both of these arch wires would be expanded out. Now, if you're just starting to use this, do not put this on somebody with about an inch of expansion and tell them to come back in 6 weeks. This is ridiculous. I mean, they'd come back and maybe their teeth would be sticking out in their cheek. You don't expand it much. Just take it out maybe 1/4 of an inch and let them come back in a couple of weeks, something like that, and see what happens. If nothing much happens, you can expand it a little more, put it back in the mouth again, and we normally expand people to start with about a 1/2 inch back in the back. So you put one side in, and then the other side will be about a 1/2 inch out, and you have to press it together and put it back into the headgear slot. Back here we come in and we make a little loop in it, and we bring it in and tie it to the arch wire here. And now this will bring the whole thing, that's this tooth and everything else along will come out buccally with that. So this is something that is a little more advanced than just regular TMJ problems. We've got a double problem here that we're trying to expand the palate and also bring the lower jaw back so that, not bring the lower jaw back, but actually bring the lower jaw forward, and we're going to move the teeth forward a little bit so that the lowers fit up in the socket, so they interdigitate properly. Let's see what we got. On this side now, we're still in there, and when I get this tooth up here in contact, we'll take this off and we'll let these teeth erupt together back in this area of the mouth. Now this is a little complicated for just beginner people. I don't care if you've been to orthodontic school, I don't think you've touched cases like this. And that's where I wish that we would be doing adult orthodontics. There's just a world of it out there, and there's nobody doing it. There's not very many anyway. So anyway, here we go again. This is the large arch wire is in here, plus we have a regular arch wire underneath it. Here's a regular arch wire, and here is the big arch wire that's pulling this out. The big arch wire pulls the upper teeth out. The little one, you put the torque in it, and it makes the root go with the crowns as it goes out in that respect. Now you have somebody who is a mouth breather. This part of the mouth will be wider than the upper part over here, and that's a problem that we have. I'm gonna let me see what we go here. Here's the lady, two different views of her. This is 1996, and yes, 1996, and that was 1987, I believe that was what. And that's good. I'm going to show you something here. Just a minute. Let me get a white screen up here. You take a mouth breather, and you've got, say, the teeth are setting here, something like this. The roots coming down here like that, and you got a mouth breather. Your tongue, and I'm going to just draw a tongue out, and you don't think about how big it is and coming across like this. The tongue sits down here, and the air has to go over the tongue. The upper molar teeth normally will fit like this. The cusp goes down in the groove on the lower in here, and the upper one over here would be the same thing, and your cheeks are out here. And when your teeth hit like this, you never bite your cheeks. Now, I am a mouth breather, and I can't, my turbinates are too big or whatever, at least allergies, and I use a Supac every night, just to breathe through it. Now, my molar teeth are setting kind of like this. The upper cusp is right over the lower cusp, right here. It would be something like this, where the upper teeth are not being pressed out, like if you don't swallow right and the tongue doesn't fit up in here, and the arch will be more narrow, and the more narrow it gets, the worse the problem comes, and it just increases on it. So everybody that is a mouth breather that has a narrow upper arch right here, they should be corrected. You expand the upper arch to where the teeth are fitting over like that, and here, and that keeps you from chewing the cheeks over here, increases the airway, and you have to put some type of buccal root torque in here to make the roots go out when the tongue, when you're chewing, and you've got pressure on this tooth, and you're expanding it here, you want something to expand the root structure too. So this is an important thing. If somebody starts this when they're kids and grow up with it, and they don't correct this, many of them don't get corrected, then we should be separating the palates on older people. And that's what I want you to learn how to do. We can separate the palate, we can expand it even if we don't separate the suture. We can develop the upper arch where it fits over the lower arch, whether you expand the suture or not. So I'm going to close out with that thought. May irritate somebody, but that is hard to do, and that's what we should actually do. So I'm going to say goodbye, and I hope you get this idea that we can expand upper arches in older people, and it can stay. Thank you now for watching.